Representative Barton asks unanimous consent for the purposes of using a visual aid. Without objection, please proceed.
Thank you, Mr. Speaker. And colleagues, this is a bill that comes to you without opposition. It is not my custom to speak at length on this floor. However, I beg your indulgence today. I'm going to talk about something that is of deep importance to me and to many children in this state. And that is the so-called community assessment centers. Community assessment centers, what are they? There are 21 of them in the state, and simply put, they are the place where the evil that is child abuse meets the light of day. It is the place where the trauma that washes across generations transitions into light and transitions into both a public safety system and a human services system. You know, we fund many essential services, this legislature, the people of Oregon do. Schools, police. There may be a more important thing that we fund than the service provided by the community assessment centers. But I really can't think of what it is. When a child has the courage, finds something within him or herself to report child abuse. In the Judiciary Committee yesterday on an unrelated bill, we heard testimony that 90% of children, it is estimated, never report child abuse. But when that 10%, when they're able to find it within themselves to report, to say, no more, this is what's happening to me, they go to one of these 21 community assessment centers. And I wish I could say that that was the end of the trauma. It is perhaps the beginning of the end of the trauma. But the experience they then go through, unfortunately, there's just no way around it, is not less than pleasant. And my friend from Oregon Sunshine District talked about several, one in Salem, one in Deschutes County. In my district, in Clackamas County, it's the Clackamas Children's Center. And there, as in most of these community assessment centers, the children would go through, for example, a specialized interview. Not just any interview, it requires some special training so that that can later yield evidence that is admissible in court. Children, of course, are very persuasive and susceptible, and so standard interviewing dialogue just doesn't do it. It requires special training. It also goes through a medical forensic examination. That process is, unfortunately, exactly what it sounds like. There's just no way around it. And as they go through that process, which must be terrifying after everything the kids have been through, each of them, at least in Clackamas, is given a bear and a blanket, which are my visual aids today. And Mr. Speaker and colleagues, this bear and blanket are given to the kids so that as they go through this process, as they go through each step of the way, which is the beginning of the end of the trauma for them, these are their friends. This is their stability. This is what they have. And if any of you have ever been in my office the last few years, you've probably seen this bear in a blanket. The Children's Center in Clackamas County, this issue obviously means a lot to me. I volunteered for them for a number of years, and a few years ago, they honored me with a gift of my own bear and blanket. I keep it in my office as a reminder of why I'm here. And apologies to my colleagues in the Judiciary Committee who hear me say this a couple times every session, but you know, the word heroes means a lot of different things. We often use it in the public safety context to talk about military or police and firefighters, and that is appropriate, but it has a bigger meaning than that. And each of us have our own heroes. And for me, my heroes are those 10% of children who somehow find a way to report. They find a way to stand up and say, enough is enough. And they go through this process, and they have the courage to see it through. And those kids save a lot of other children's lives. That's where the trauma ends. And that's what these community assessment centers do. This bill will help them get reimbursed at a level commensurate with their costs and the specialized services that they provide. It's an honor to co-carry it, and thank you for listening to me, colleagues. I know we're all on the same page on this topic, but again, it means a lot to me, so I appreciate your indulgence. Thank you, Mr. Speaker.